7:30 or 7? I wrote 7. John. Gynecological Society, the YASA team, led by Faisal Ahmed, members of the press, ladies and gentlemen, good morning. Morning. It's a great pleasure being here this morning on this wonderful occasion where we are going to acknowledge the award that Microclinic Technologies has just received recently from GSK and Save the Children. And this morning will be a wonderful time of engagement and interaction about how this new technology, which you'll hear a lot about, is going to change the face of the health industry in this country. I'd like to introduce to you John Musunga, who is going to be our moderator this morning, and Duncan Harvey from Save the Children. And without further ado, John, over to you.
Good morning, everybody. Good morning. And I think Kathleen has taken over my role and done what I should have done this morning. So it's pretty straightforward from now onwards. Professor Segor, PS, Ministry of Health, invited guests, ladies and gentlemen. Today is a wonderful occasion where we are celebrating innovation in healthcare. Innovation with partnerships with government, innovation with partnerships with other stakeholders like Microsoft and local developers of software. And we really want to bring this to the fore today. So today is about Microclinic Technologies and all the partners that they've worked with to bring in a solution that has the potential to really change the way healthcare is managed from a technology perspective and integrate a lot of facilities and assets that will change the way health.
Our chief pharmacist, Dr. Koske. Yes, Dr. Koske, for spearheading this process on behalf of the ministry. Of course, the team, the working team, the technical working team, he was the head of this alongside other officers. And they have worked very closely with the chairperson, Mary, and other technical team, including Munyo, to come up with this process. It is my hope that now that we have the basics, we take it to the next level. We are looking forward to supporting this initiative. And as a ministry, if this was to happen like tomorrow, we will say hallelujah. We will be very happy. So, ladies and gentlemen, I want to take this opportunity to thank you for what you've done, and we look forward to engagements on this. Otherwise, thank you very much. We will continue discussing on this. Thank you very much.
We are seeing the way inventory is managed at the level of the stores at the Kenya Medical Supplies Authority, and to the way the inventory is managed at the small stores in the health centers, the dispensaries and hospitals, and the way those assets are taken care of. And with technology, we are able to ensure that we have low operational costs. Our principal secretary has just enumerated the kind of agony that the health workers go through with a lot of manual registers, a lot of records, a lot of data to correct and write, and books that are kept, and some that are lost in the course of time. And with this kind of technology, we are sure that all those kind of operational costs will be minimized because of the efficiency that comes in. And therefore, we have better quality of service, and we have better operational efficiency. And the other benefit that we get from mHealth is that you cannot run a service, you cannot run a supply chain, whether public or even managed health services, if you do not have accurate and reliable data for decision making.
The WHO requires that a person should be within 5 kilometers of a health facility. Of course, in Kenya, we've not reached that. We are working towards that. And that is the reason why 3 years ago, the government, through the Ministry of Treasury, supported the building of a model health facility in each of the constituencies. So 210 health centers were built in each of the constituencies. This is one way of addressing the people assessing facility.
Well, we did the proof of concept for the second question. We did the proof of concept in 10 facilities in Muhoroni, and we've piloted in 3 of those. Nyangoma Health Center, Kasongo Dispensary, and Chemiril. The success we've had is tremendous in that, like my colleague Dr. Lansom mentioned, we've had improved access to immunization. Dr. Kiara, one of the things we noticed when we started, because it's just when the president had launched free maternity, the first data that came through, I looked and I said, we were having more immunization than deliveries of BCG. So to me, that was a very red flag. I said, are they over-immunizing? We were able to go and look at that, and what came out is that a lot of women are delivering at home, therefore risking their lives. So access to that data of women, that just not even looking at the immunization data, we were able to understand that women were delivering at home. If the free maternity system that the government is promoting is to succeed, women have to deliver under proper healthcare givers.
I think there's a very simple answer to that. The GSK Save the Children Global Partnership has a very simple objective, and that's to save 1 million children's lives. And 1 million children's lives can seem like a very ambitious objective, but we've already seen since in 1990 we had 12.6 million children under the age of 5 dying every year. That number has now been reduced to 6.6 million children per year. So we know that huge progress has been made. We know that the vast majority of children who are dying under the age of 5 are dying preventable deaths, and that actually we don't. The countries that have made the fastest progress are not necessarily the rich industrial countries, but actually developing countries have made enormous progress. So we know what can be done, and so by setting up this award and having the partnership between GSK and Save the Children, we wanted to promote an innovation that was going to help us to contribute towards that objective. So therefore it needed to be an innovation that could be applied in country contexts that have still the highest burden of childhood deaths, that could be used not just in cities but in rural areas where we know that healthcare coverage is more limited. Not just in Kenya, but this is a global award, and I think we should be stressing this is one of 5 awards that have been made this year, and that it needs to be applicable in the areas where we're still seeing the highest numbers of children, babies dying on unnecessary and preventable deaths.
Shake hands, you're looking at each other, not at the picture.
Martin was easy. Martin is in the international photo.